Hi, I'm Kate Marie. I'm the author of the Slow Aging book, and I'm here to investigate at Shine Clinic what I can do about my aging hands. And I thought I'd better get tucked into them right now because I don't want to get ripped hands and torn body parts. So I'm starting with my hands, and I'm consulting with Dr Kathy Gallagher, and I'm hoping she'll take me on a journey of discovery about how to fix these aging hands. So we're preparing for hand rejuvenation.
Hand rejuvenation. Okay.
Yeah.
And what products are you thinking of using?
Well, we're going to use Juvederm. The one I'll use in Kate is called Juvederm Vol-Lift. We have actually done a treatment with the Vol-Lift before, so this will be a second treatment. Juvederm Vol-Lift has a very good effect in dispersing well in the tissues. So it gives a very natural effect and plumps up the skin.
So it's a dermal filler?
Yes.
Okay. Because what, do you put anything else in the hands if you do this kind of treatment?
There's a lot of things that you can do with the hands. I mean, from the point of view of plumping the hands, the two options are the dermal filler, and you can use a lot of different types. I mean, there's a lot of different types that will do the same job. Or you can try and improve the quality of the skin on the hands, and there are other treatments that we can do for that.
Like what?
Platelet-rich plasma is a good option. Basically, where we take your blood, spin it down in the centrifuge to separate the blood from the plasma, and that in the plasma we have the platelet-rich plasma at the bottom and we have the platelet-poor plasma at the top. We want to take out the platelet-rich plasma, full of growth factors, and then we inject that very superficially into the hand, and that will stimulate collagen, it'll stimulate cell turnover and improve the quality of the skin in that area. So that's another option. We can also look at improving the skin through using topical skin creams, things that help improve cell turnover, things that help lighten the skin. Different topical creams will do that. And also IPL is the other thing that we use a lot for hands, because IPL will treat pigment. So a lot of the problem with aging hands is they do develop a lot of red and brown pigment. Especially as we get older and we see a lot of sun, so IPL is the best treatment. It's a course of treatments and it will reduce that.
Is that better than using laser, do you think?
Laser and IPL will both be effective.
Because I've had laser before and I ended up with almost like white gloves. Because it takes all the pigment out of your hands. But now they're getting spotty again, so it doesn't last forever.
Nothing lasts forever because we're constantly aging.
So can I just ask you what Julianne just did on your hands?
So this is just a local anaesthetic. It's quite a strong local anaesthetic. I like to put gloves on now, so we might give her a pair of gloves too.
Thank you.
There we go.
Right.
It's a product that has some volumizing effect. It'll also help with hydrating by holding water in the skin, water under the skin. And it disperses very well underneath the skin, giving us a nice even effect. So what we'll do first is clean the anaesthetic ointment off. So these are lumps from using the wrong product.
How can I remove them?
I would think they will go away because they're from collagen stimulation. What I'm going to do is just pinch up a little piece of skin and then putting a little injection in underneath that little V that we create, and we end up with a little lump. We'll massage that at the end. So I'm just going to look for areas where there is less volume, and that's where I'm going to inject. If we lift up the tissue like that, then we can minimise the chance of injecting a vein, which would then cause a bruise. Still can't promise there won't be bruises, but it's less likely if we do this. So they're little lumps, that's nothing to worry about, they'll be massaged away. It's important when you do this that you don't over-inject the hands, because then you just look like you've got fat hands. This is just a cream with arnica in it. Arnica helps reduce bruising. So I use quite a bit of force here just to spread this around. Is that hurting you at all?
No.
So how would you rate the pain out of 10?
Oh, it doesn't hurt. 1 out of 10.
Just normal cleansing and moisturising tonight, and avoid any active ingredients like
Okay.
vitamin A or glycolics for 24 to 48 hours. The swelling there, we have to let that all settle down.
Okay.
Hold on.
All right, beautiful. It's 4 weeks after I've had my hands done, and I'm very, very happy. So thank you, Kathy. The hands are looking a lot less veiny, and the skin texture seems to have improved. The cost was about $1,400 for 2 hands. This lasts about a year, and I think it's well worth doing for good return on investment, particularly if you had veiny hands or hands that reminded you of your grandmother. So yeah, I do recommend this treatment. Thanks for watching. I hope you subscribe to this channel, because over the next 12 months we're going to be doing some interesting interviews. I'm going to be doing lots of treatments, and hopefully you'll be able to make a better informed decision by coming along this journey with me.